12 cancer signs mostly ignored by women. A woman's body is constantly changing. Her body will change even more as she ages. Unfortunately, some of the changes that women go through may seem normal, but in actuality they're not. These symptoms may indicate cancer in certain situations. It's crucial for women to keep an eye on the changes their bodies go through as a result. The body has a method of alerting us when something is off. We are all quite familiar with our bodies. We should all be alert and take the appropriate action to make sure that nothing is amiss with our health whenever we notice a change. When we notice a new symptom or a new change, it's important to educate yourself about it by consulting your doctor. Before we begin this video, don't forget to subscribe to our channel for more daily tips like this and turn on notifications so you never miss our new videos. Now, here are 12 common cancer signs that are mostly ignored by most women. Number 1. Changes in the breasts. In many cases, a lump on the breast doesn't necessarily mean cancer. However, you ought to speak with your physician if you discover a lump in your breast. Additionally, be careful to inform your doctor if you observe any nipple discharge, nipples moving inward, or any redness or scaling. To make sure your health is in good shape, you should also make sure to visit your doctor for yearly checkups and a comprehensive physical examination. Number 2. Bloating. According to Marlene Myers, an oncologist at NYU Langone Medical Center, women are natural bloaters. Women are likely aware that they frequently bloat throughout their menstrual cycle or after consuming a meal that contains a lot of carbohydrates. However, see your doctor if the bloating does not go away and is accompanied by bleeding or weight loss. One of the main cancer symptoms that many women neglect is persistent bloating. It can be gastrointestinal cancer, pancreatic cancer, ovarian cancer, or colon cancer. Never disregard any strange physical changes. Number 3. Bleeding between periods. If you're continuously spotting between periods, go speak to your doctor. Any bleeding that is not part of the menstrual cycle may be due to many different causes. Your doctor will want to rule out endometrial cancer, so be sure to notice any changes to your menstrual cycle. Number 4. Changes in the nails. One of your toenails may have a tiny brown vertical line that indicates melanoma. Dr. Phoebe Rich, a dermatologist at the Oregon Dermatology and Research Center, states, in more advanced cases, it can spread onto the cuticle area or the skin around the nail. That's concerning since it indicates that it's expanding. Thus, to make sure it's not melanoma, you might want to get in touch with your doctor if you observe any strange changes to your toenails. Watch to learn about some even more startling symptoms of cancer that women choose to ignore. Number 5. Blood in the urine or stool. In most cases, blood in the urine or stool is caused by hemorrhoids, but it can also be a sign of colon cancer. If you're bleeding from an area that doesn't usually bleed, consult your doctor. Especially if this bleeding lasts for more than 2 days. Number 6. Lymph nodes changing. Lymph nodes help our immune systems function and act as filters for cancer cells and other foreign particles. Cancer in the lymph nodes can be life-threatening. The infections are usually harmless. But in some cases, such as leukemia and lymphoma, they also cause the lymph nodes to swell. If the swelling is present for at least a month, speak to your doctor. Number 7. Can't swallow. It's natural to have trouble swallowing at times. But if it is happening often, and vomiting and weight loss are also present, you may have throat or stomach cancer. If these symptoms have not subsided after a few weeks, go speak to your doctor so he or she can properly examine you. Number 8. Unexpected weight loss. Many women dream of having their weight miraculously disappear. However, if you lose this weight without increasing your exercise or altering your food, there may be a problem. Stress is the primary cause of unexpected weight loss in most cases. However, pancreatic or colon cancer can occasionally be the cause. See a doctor to rule out the possibility of cancer or other ailments if you discover that you are losing weight while not changing your diet or exercise routine. Number 9. Heartburn. Heartburn can be caused by excessive food or alcohol consumption. It will eventually go away with time and rest. If the heartburn does not go away, or it gets worse, it could be stomach, ovaries, or throat cancer. In addition, constant heartburn will damage the lining of the esophagus, which can develop constant heartburn will damage the lining of the esophagus into Barrett's esophagus. This condition raises the risk of developing throat cancer. Some people are more prone to heartburn. If you notice that you frequently get heartburn after you eat, be sure to find out what types of foods trigger your heartburn. This way, you can eliminate those foods from your diet and significantly reduce your heartburn. Number 10. Changes of the mouth. For women who smoke, look for white, yellow or gray patches inside your mouth. Cancer sores will also develop, which could be a sign of oral cancer. Number 11. Developing a fever. When people develop the flu, they have a fever that will last a couple of days. But a fever that does not subside can mean many different things. Leukemia and other blood cancers can be the cause of the fever. If you have an ongoing fever and cannot determine the cause of it, visit your doctor or the emergency room to determine what may be causing it. Number 12. A cough. Most people who develop coughs will see it go away within 4 weeks. Any cough that lasts longer than a month should not be ignored. If you're a smoker or are having shortness of breath with this cough, consult your doctor. A cough is the most common sign of lung cancer. If you notice that you have a cough for an extended period of time and have ruled out a cold or any other illness, try to reduce the amount of cigarettes you smoke daily, if you smoke, and be sure to make an appointment with your doctor to determine what is causing your cough. Now that you know some of the most common cancer signs that are ignored by women, be sure to keep your health in check and contact your doctor if you notice any changes in your health. If you have a healthy lifestyle and a good diet but notice that your health has recently changed, be sure to take the proper precautions to ensure that you are not at risk for any serious illnesses. If you are not active and your diet needs improvement, try to incorporate some healthy lifestyle changes into your daily routine. This can include creating a new exercise regimen, reducing smoking and drinking, and making changes to your diet. There are many different signs and symptoms which are ignored by women all over the world. If you notice that you have any of the symptoms in this video, don't panic. It is likely that you don't have cancer, but it is always a good idea to take the right steps in the event that you notice any lingering, unusual symptoms. Before making any changes to your lifestyle or your diet, be sure to contact a medical health professional. Never take your health for granted. What do you suggest women should do to maintain a healthy lifestyle? Let us know in the comments section below. Enjoyed this video? Hit the like button and subscribe to our channel for more videos like this. Thanks for watching.